I have so many questions for you about kids. I don't even know where to start. But can we start first with how we talk to kids about this pandemic in a way that they can understand?
Yeah, I think it's affected all of us, but kids in really significant ways. They're not in school, they're not able to meet their friends in person at this point, and their sports and other group activities are not in session right now. So it's important to kind of elicit what the concerns that the particular child might have, because you don't want to create undue anxiety over something that if they have no concern about it. So finding out what they're concerned about and addressing that directly in an age appropriate way is probably the best way to deal with it.
You've talked about some of the things that concern me, being away from friends, being away from school, being away from your activities and your schedule, also being away from your, excuse me, your grandparents and
Yes, yes.
family and loved ones. What kind of implications does that have for social development and a sense of security for kids?
Right. So it's really important to try to maintain those connections as much as possible, even through the social distancing requirements that we have right now. So making opportunities to talk on the phone or through video meetings and chats is really important. And then talking to the kids about why we're doing this, helping them to understand that, we're trying to protect people who are vulnerable to this infection and that can be, seriously ill with it.
There was one little girl, the child of a friend of mine, who was seeing her grandparents walking with them, but they were distancing by 6 or 8 feet. And the little girl thought maybe she had done something wrong and that was why she wasn't getting hugs from her grandmother, which I thought was heartbreaking and also an insight into the way kids' minds sometimes work.
Yes, yes. It's important for us as the adults, parents, and caregivers for these children to look really closely for cues of anxiety, stress, concern that you might see in your child through their behaviors, and ask them about it, because they need to know why we are behaving in the way we are, which is different from before. Because if we don't explain that to them properly, they will actually make up things in their own mind that are much more horrible than what the real situation is.
How do we talk to kids about the impermanence of this situation? They've never lived through something that happened and then was mitigated. So it must feel to them like this is going to go on forever.
Yeah, I mean, I think for the adults, it feels like it's going on forever as well. But trying to talk to them about this is not forever, that there is an endpoint to this. It's not yet, but we're going to have to see how the situation develops. We can't give them, unfortunately, a firm date at this point, but we can tell them that things will get back to more like they used to be in the future.
What do we know about how coronavirus affects kids? We hear that they don't tend to get as sick, but some kids do get it. And we hear reports now that there are complications afterwards in some children.
Yeah, we don't know a lot yet because it's a new virus, but we are learning every day that the virus can affect the kids in ways that we didn't anticipate. Up to this point, most of the kids who've been infected seem to have done okay, but it really remains to be seen the long-term consequences of an infection. So much of that is yet to be determined.
I may be wrong about this, so I'm just throwing it out there. Did I read that there's some kind of toxic shock syndrome sort of thing that's happened with some kids who've had coronavirus?
I think they're talking more about, not all kids just fly through the illness without any issues. Some kids get sick, and I think the toxic shock syndrome analogy was kind of a relation to the kids who did get sick. They tended to have this inflammatory storm in their body that made them sicker, and it's kind of like a toxic shock syndrome. So they were kind of comparing the two illnesses, I guess.
For some of the kids who did get sick, what happened?
So for some of the kids who got really sick, we think that there was an excessive inflammatory response that their body made, kind of like the toxic shock syndrome that we would see in adults.
Wow. What would it take to get kids back to school?
It's going to take a reduction in the number of cases. The same thing that's going to take for us to get back to going to work and doing our daily lives. We're going to have low enough numbers of infections that public health will be able to do contact tracing and containment on the numbers of people who are infected. Otherwise, it's going to continue to spread and infect a lot of people.
Do you anticipate that will last for the rest of the year? Will kids be back to school in the fall? What do you anticipate?
Well, we already know they're out for the rest of this academic year.
Right.
The fall is a hopeful situation for kids to go back to school. It's not a guarantee, though. You know, I would like to take this opportunity to thank Washington for doing a great job as far as reducing the numbers of infections, flattening the curve. But part of that means that the epidemic itself may be prolonged a bit because the numbers didn't spike up really high, but it's going to be at a lower level for a longer period of time. And so until it really gets down to where the public health authorities can manage the infections that they find and we get more testing, we're going to have to kind of stay in the situation for right now.
But what you're identifying, both the testing and getting the cases down to a reasonable level where we could isolate and contact trace, seems like it's a long way off.
It's a little ways off, yeah. So when you look at the data, we flattened the curve, but it's just drifting down ever so slowly right now. So if we relax restrictions too soon, we're going to see a big spike up again.
You're on the immunization task force in the state, correct?
I'm the chair of the Immunization Action Coalition of Washington, yes.
Okay. What has that work done to inform you on what might be happening with vaccine development?
Vaccine development is ongoing at a breakneck pace. You know, everybody is working on this as hard as they can. Vaccine development is very, very difficult. So it requires a lot of testing and research. So it could be a while before a vaccine comes out. So I don't think I think we're gonna have to work more. It'll be more likely that we get to our former lives by reducing the numbers of infections through social distancing than with a vaccine, because it could take a while.
The social distancing rules are relaxing in many states, and as we know, the virus doesn't stay contained to one place or another. So as we open up, obviously cases are going to increase. What's the likelihood that once that happens, we could actually dial it back down again?
Yes, so that's the dilemma. So if the social distancing rules are relaxed too soon, or if there's too much mobility between places that relax them and places that don't, then we're going to get spikes in cases and we're going to have to lock down further again. And it could be a longer process if we relax our rules too soon.
I'm wondering how you think of this as perhaps a transformative event. After 9/11, for example, things changed, the way we traveled on airplanes, all that kind of thing, and it stayed changed. What kinds of things do you think will stay changed after this?
That's a great question. I believe this is truly a transformative a pandemic for us. We're going to change a lot of our behaviors, I think. And things are going to be different for all sorts of jobs and people's recreational activities and the way we live our lives. We're going to have to be a little bit more, we used to think of people as germophobic, and that's an oddity, but now it's going to be more of a normal thing, so we're going to have to deal with that.
What are you doing personally? Do you wear a mask everywhere? Are you avoiding crowds? How are you dealing with this yourself, knowing what you know?
Yes, so I avoid going in any groups of people. I wear a mask when I'm out in the public, and I have to go to the grocery store at times. I wear a mask at work because I have to actually go out to work and see patients. So I follow the rules, and I encourage people to do that, because that is what's going to make our lives return to normal quicker. If we don't comply and the infections continue to occur, it's just going to take longer.
Should kids be wearing masks?
Kids should be wearing masks. Older kids above 2 should be wearing masks as well. You know, masks protect people by reducing the amount of respiratory droplets that someone might inadvertently cough or sneeze onto somebody else. So wearing a mask is not a sign of fear of infection. It's a sign of respect and trying to protect other people.
Thank you so much. I appreciate you talking to us. Anything else that I missed that you think is really important to add?
No, I just want to say thank you for informing the public on this really important public health issue. I appreciate it.
We're going to do our best and we're going to stick with it. Thank you so much.
Okay, thank you. Bye-bye.
Good to sort of see you again.